Hi everyone, I'm Dr. Walwyn Brown, and in this video I will demonstrate to you how to do a breast self-examination. The breast self-exam is an inspection of your breast on your own where you are using your eyes and hands to look for changes in your breasts. Now, why is this important? Doctors believe that there is value in the breast self-exam as a number of women have been able to report the first sign of breast cancer on the discovery of a lump on their own. And so doing this exam helps you to be aware and familiar with the normal look and feel of your breasts. So when you notice a change, you can promptly report to your doctor or healthcare provider and get treated early. Now, this exam can be done by both males and females. Try to start early so you can learn what is unique or normal for you from an early age. This exam should be done every month, and the best time for the exam is about a week after your period ends, as some changes to breast tissue can occur with the menstrual cycle. If you're postmenopausal, you can do it anytime in the month. The breast self-exam is done in two main parts: the visual examination, where you're looking at your breasts, and the manual part, where you're using your hands to feel for any changes. So let's start with the visual examination. In this step, while standing or sitting in front of a mirror without a shirt and bra, facing forward, you would look at both breasts with arms at your side and hands on your hip and note any differences. For some women, it's normal for one breast to be slightly larger than the other, and each woman may have different appearances. So know your uniqueness and know what's normal for you. Look for any changes in size, shape, symmetry. Look for dimpling or puckering, that is, irregular folds or wrinkles. Look at the nipples and note if any inversions. Normal breasts are evenly shaped without distortion or swelling. To examine further, you bend forward with your hands on your hip and look again for any changes. Are there any differences between the right and left breast? For example, does one breast look unusually larger than the other? Is there any redness, localized swelling or dimpling? Any rashes? Note where on the breast these changes are, if any. Next step is to raise your hands above your head, press your palms together, and again check for any changes in appearance. Turn to your left and to your right and look to see if there are any changes on the left side of the breast and on the right side of the breast and under the arms. Also, lift your breasts to look at the ridges at the bottom of each breast for symmetry. The second aspect of the breast self-exam is to examine the breast with your hands to feel for changes. For this part, you can lie down or stand in the shower. Lying down helps to spread out the breast tissue and makes it easier to feel. While in the shower, when lathered with soap, the fingers slide smoothly over your skin. If lying down, you can put a pillow under your head and upper back for support. You then raise your hand above your head and use the opposite hand to examine the breast on the side of the raised arm. To examine the breast with your hands, you will use the pad or the flat part of your three middle fingers, that is your index, middle, and ring fingers. Do not use the tips. With the three fingers held together, you press gently, then firmly with a circular motion. At this point, you can think of the breast as a pie or clock and examine each section in a circular motion, starting at the midpoint of the collarbone and in a circular pattern from the outer segment to the inner segment of the breast. Try not to lift your fingers completely off the breast while examining, so as not to miss any sections. When you get to the areola or darker part of the breast, try to press under the nipple to feel the tissue under the nipple. To complete the breast exam, press the nipple between the thumb and index finger and look for any discharge or bleeding. The next step is to examine the axillary area or underarm. With your arms still raised, feel in the armpits for any lymph nodes or swelling. You can also feel deeper in your axilla while lowering your arms. If you notice any of the following, such as a change in look or feel, or if you notice thickening or fullness, or a change in size, shape, or symmetry, or you discover a new hard lump or bump in one breast or armpit that's different from the same area on the other side, or if you find dimples, wrinkles, bulges, redness, warmth, swelling or pain, itching, scales, sores or rashes, or there's a change in nipple position, that is, if it's pointing differently or pulled in or becomes inverted, or you find a bloody nipple discharge or any discharge, please do not hesitate. See and report these changes to your doctor immediately. Remember, not all changes picked up in the breast self-exam indicate breast cancer, but it is important to follow up with your doctor to discuss any unusual findings. If you have difficulty to perform these steps, such as difficulty seeing, difficulty moving your arms, or other challenges, a trusted relative or friend can help, or your doctor can suggest a technique appropriate for you. So there we had the breast self-exam. Please remember that the breast self-exam does not substitute for the clinical exam done by your doctor or screening with a mammogram, but it complements these recommended screening methods. Your doctor will discuss your risk for breast cancer with you and will give you specific recommendations for care. So once again, practice doing the breast self-exam. So if anything abnormal appears, you can report it early and get timely care. Early detection saves lives. If you need more information, please visit the Health Promotion Unit or your nearest health center or your doctor. Thank you for viewing.